It is National Diabetes Awareness Month as well. A new study reveals diabetes is becoming the leading cause of death. Global health experts are sending warnings after seeing alarming numbers.
Diabetes is a leading cause of death and disability worldwide. Now, new research published in 2 Lancet journals shows the diabetes crisis is worsening worldwide, with no country expected to see a decline in rates over the next 3 decades. The study analyzed data from more than 200 countries and territories for about the last 30 years. It's estimated 529 million people are living with diabetes worldwide. That number is expected to jump to more than 1.3 billion in 2050. The research points to systemic racism and insulin access in low and middle income countries for the skyrocketing rates of disease and death. Complications from diabetes can include blindness, kidney failure, heart attack, stroke, and amputations. Researchers stress that diabetes is largely preventable and can be controlled by eating healthy and staying active. In some cases, diabetes is even reversible if detected and managed early.
According to the CDC, about 37 million Americans have diabetes, with 23% of adults undiagnosed. Well, maintaining a healthy weight vital for those with diabetes, which is why some people opt to use drugs like Ozempic and Wegovy to lose weight. A new study is warning that the drugs can lead to an increased risk of severe stomach problems, including some rare gastrointestinal conditions that could be life-threatening.
I'm down to 172 pounds like it was magic.
Prescription drugs used to suppress appetite have exploded in popularity this past year, with social media influencers and celebrities sharing the success they've had using the drug semaglutide, marketed as Wegovy and Ozempic, known technically as GLP-1 agonists.
Type 2 diabetes?
Discover the Ozempic Trizone.
Developed to treat diabetes, Ozempic's off-label use for weight loss is driving its demand. But now a new study from the Journal of the American Medical Association found that for every 1,000 patients who used the drug, some suffered moderate to severe stomach problems, including pancreatitis and stomach paralysis.
Each one of these complications could be serious enough that it could be life-threatening.
NYU Langone chief gastroenterologist Dr. Mark Pochapin says patients outside of the drug's target audience are at a higher risk for exhibiting rare side effects.
The American psyche is give me a pill or medicine to fix a problem.
The drug's manufacturer, Novo Nordisk, responded to the findings, saying it stands behind the safety and efficacy of all our GLP-1RA medicines when used consistent with the product labeling and approved indications. The study comes as drug companies work toward manufacturing a generic version of the drug, which, if successful, would give more people access.
Well, a new study says what time you work out may be a new trick to seeing some better results.
What time you exercise can have an effect on preventing type 2 diabetes. A new study published in Diabetologia finds people who work out in the morning or afternoon can reduce their risk by about 10%. But for people who hit the gym after 6 p.m., there was no significant reduction. Study co-author Dr. Chirag Patel says vigorous exercise can make up the difference.
If you look at sort of hardcore physical activity, things that would make you sweat, those things across the board, no matter what time, had lower risk for diabetes.
Researchers looked at data from more than 90,000 people in the UK who wore a device on their wrist that tracked physical activity. They found having a daily routine isn't important, but getting the exercise is.
We detect activity on your watch on Monday, for say 2 hours. That's no different than looking at an individual who exercises a total of 2 hours during the week.
The CDC says about 1 in 10 Americans have diabetes.
Well, Dr. Patel says the results were still statistically significant when adjusting other factors like sleep and diet as well.